Hello everyone and welcome back to another episode of Anatomy Basics. This is episode 3 where I'll cover the spine and connect it to Chinese medicine. In our previous episodes, we went over the planes of movement, a little bit about the directions of movement, the 12 primary meridians in Chinese medicine, and the 5-element theory and organ systems. Today, as we discuss the spine, I want to go over the primary curve of the spine. So we have normal curvatures of the spine as well as pathological curvatures. And when I say pathological, that means outside of the norm. So the primary curve of the spine is the kyphotic curve. Think about a roundness in our spine when we are in the womb. So the baby is curled in like this, the fetus. That is called the primary curve, which is our kyphotic curve. Then upon exiting from the mother's womb, we start to develop the lordotic curves, which are found in our lumbar spine, which is our low back, and our cervical spine, which is the neck. These curvatures begin to develop as the baby starts to lift their head up, usually suckling for the mother's breast and looking for the milk. And that's when the neck, the cervical lordotic curvature, starts to develop. Then as the baby starts to crawl and move around and wiggle their back, that lordotic curve or the lumbar curve starts to develop further. Now, if you look at the spine in this image on the screen, you'll see that the spine curves like this, right? So we have a lordotic curve in the cervical spine. We have a kyphotic curve in the thoracic spine. We have the lordotic curve in our lumbar spine. And then again, we're back to the kyphotic curve in our sacral area. So we have several segments to our spine: the cervical, thoracic, lumbar, and sacral. And each of these spinal segments have a specific number of vertebrae. And in the cervical spine, we have 7 vertebrae. In the thoracic spine, we have 12. In the lumbar spine, we have 5. And then in the sacrum, we have 4 fused vertebrae. And in the coccyx, which is our tailbone, the extension of the sacrum, we also have a fused vertebrae. So it could be up to 3 fused vertebrae. Everyone has a little bit of a different length in their tailbone. Some people have a very long tailbone, some people have a shorter tailbone. Okay, and going back to how many vertebrae we have, the good way to remember is breakfast at 7, lunch at 12, supper at 5. So 7 cervical, breakfast at 7, 12 thoracic, lunch at 12, and supper at 5 for 5 lumbar vertebrae. Now, when you're looking at textbooks or maybe even Googling online, you will see the shorthand, or even if you're looking at your medical diagnoses, you can see that the cervical spine is numbered C1 through C7, thoracic spine T1 through T12, lumbar L1 through L5, and then the sacral would be S through S1 through S5, okay? Those are just simple ways that you might see in, let's say you're looking at an MRI, right? Or a client comes to you, especially if you're studying to become a massage therapist, a client comes to you and they say, oh, I have a herniation in my L5-S1. You know exactly what that means. That is the junction between the lumbar segment and the sacral segment at the last lumbar vertebrae and the first sacral vertebrae. Now, when we talk about the spine in Chinese medicine and we look at the back body, the muscles that attach to the spine and that are lying on top of our rib cage, These are called the erector spinae muscles. And we have the urinary bladder channel that lies on that aspect of the body. Urinary bladder channel actually belongs to the water element, and the first point starts in the inner canthus of the eye, goes up the skull, down the back of the nape of the neck, and then it bifurcates. It splits into two, and we have the inner line and the outer line, which we call the inner and the outer shoe line. The back shoe points are the points that directly correspond to specific organs in the body. So the points that are between our shoulder blades correspond to the lungs, to the heart, to the pericardium organs. Points lower down, level with the diaphragm, correspond to the diaphragm. We have points further down the back that correspond to our spleen and stomach and the liver and gallbladder and our kidneys. And then all the way down towards the sacrum, we have points that correspond to the small intestine and large intestine. And then the points directly over the sacrum can treat issues with the urinary system, reproductive system, or just your everyday back pain, depending on the area of tension or discomfort. We also have a channel that runs directly over the spine or through the spine, which is called the due meridian. This is also a governing vessel. So issues with the spine can be addressed by treating this particular channel. However, we can address issues with organ system as well by targeting points that are called Hua Tuo Jia Ji points. And these points can be found between the transverse processes of our vertebrae. So when we look at the vertebrae, you can notice the difference between the cervical, thoracic, lumbar vertebrae and the spinous processes, how they stick out differently in each of these areas of the spinal segments. The transverse processes are sticking outwards transversely, and the spinous processes, when you're looking at the body sagittally from the side view, you can see the spinous processes sticking straight out. So the cervical vertebrae a little bit more straight out protruding, while the thoracic spinous processes vertebrae are curved and longer. I always like to joke around and say if the thoracic spinous processes were sticking out more, we would look like we're dragons. And then the lumbar vertebrae as well as the spinous processes are just stockier and shorter. And the lumbar vertebrae, because they're holding the weight of the rest of the upper body and the rest of the spine, are wider, are thicker, and denser. So the cervical vertebrae in the neck, they're the smallest. They have a lot of mobility. The thoracic vertebrae are bigger. They have less mobility because the ribs attach to those vertebrae. And then the lumbar vertebrae are the stockiest because they're holding up the weight of the entire spine. In between each of these vertebrae, we have our spinal discs, which are basically cushions which allow for shock absorption. Now, the movement of the spine, and we've discussed directions of movement in episode 1 when we were covering the planes of movement, the planes of movement being the sagittal, frontal or coronal, and the transverse plane. When we're talking about the spine, we have flexion of the spine, so when you're curling forward, which is happening in the sagittal plane. We have extension of the spine, such as when you're doing a back bend or when you're standing upright erect, again in the sagittal plane. We have lateral flexion and extension, which happens in the frontal plane or coronal plane. And then we have rotation, which is happening in the transverse plane. If we talk about the pathologies of the spine, the normal curvatures, like we said, are lordosis, kyphosis, and lordosis of the cervical spine, kyphosis of the thoracic, lordosis of the lumbar spine, and then the kyphosis of the sacrum. However, we could have too much or too little of each of those curvatures. So for instance, too much of that kyphotic curve in the thoracic segments is called hyperkyphosis. Too little, or the spine being flatter in the thoracic segments, is called hypokyphosis. Too much lordosis, whether it's in the cervical or in the lumbar spine, is hyperlordosis. And when the spine is flatter in those segments, it is called hypolordosis. So you may see hyperlordosis of the cervical spine with someone who has their head overly extended for prolonged periods of time, and then because of the pulls of the muscles on the bones, because muscles attach to the bones via tendons. Tendons are the extensions of the muscle tissue that attach to the bony tissue. And so when our muscles attach to the bones, they start to create tension, right? The contraction. When we take a certain shape over a prolonged period of time, that can change how our bones act, and that can change our posture in the long term. For instance, hyperlordosis in the lumbar spine, also known as swayback, is seen a lot in gymnasts because of the way the gymnasts use their musculature. It's pulling on the spine. They go into extreme movements. Also, contortionists do extreme movements. So all of those extreme movements using extreme contraction of the muscles pull on the bones and create those abnormal curvatures of the spine. Now, a lateral abnormal curvature of the spine is called scoliosis. I'm sure a lot of people have either had loved ones who've had scoliosis, or maybe you yourself is experiencing that. Scoliosis is basically a lateral curvature. It could be a C shape or it could be an S shape, which is a little bit more exaggerated. And it could be functional or structural scoliosis. So when we say functional, that means that muscles on one side are tight and pulling the spine out of alignment. And so there's a test, an orthopedic test that we do as therapists, where a person folds forward in spinal flexion when they're standing up, and we look at the spine. And if the spine still has that curve when they're folded forward, that is a structural scoliosis. So structural scoliosis, we can't do much to change that, right? We could do massage, we could do postural corrective exercises, but if it's far, far in their life, meaning a person is not of a very young age, most likely we're not going to be able to correct this scoliosis. If it's a functional muscle pulling the bone out of place, then we can definitely work on that with manual therapy as well as postural corrective exercises and get the person to realign their spine back into proper position. Other pathologies relating to Chinese medicine specifically could be addressed with working on the kidneys, kidney energy, as well as working on the urinary bladder channel. And like I said, the Du meridian, the Du channel. Anything relating to the spine, back pain or back pain with knee pain could be indicative of a kidney qi deficiency or kidney essence deficiency. Also issues with nerves or issues with the brain, right? The brain and the spinal cord are part of the nervous system, and the spinal cord is encased in our spine or our spinal column, right? So the vertebrae are actually protecting our spinal cord from damage. And then we have the spinal nerves that are coming out between the vertebral spaces and innervating muscles and the rest of our system. So this is a short introduction to the spine. Again, as far as the Chinese medicine, anything relating to the spine is usually attributed to the water element, the kidneys and the urinary bladder as far as the treatment goes. As far as postural corrective exercises, they can be very helpful with fixing our hyperkyphosis or our scoliosis or even hyper or hypolordosis just by working on the muscles themselves. So I hope you enjoyed this episode, and if you have any questions, put them in the comments below. And as always, please like and subscribe and share the video, and I'll see you in the next one.